Thank you so much for having me. It's a pleasure to be here. And to give you a little bit of background, as Dr. Walter said, I'm a assistant professor in medicine and geriatrics at UCSF. I'm one of our main clinicians, so I am one of the doctors that works in our house calls program seeing patients who are homebound. So we're going to talk about a couple different things today. What I'd like to do is actually discuss the concepts of loneliness and social isolation. I want to describe the effects of loneliness on our health, and we'll talk about how we can use community resources to address issues of loneliness. And lastly, talk about whether there are potential strategies to deal with loneliness. So we're going to start with 3 stories. So this is a tough topic because it's not the most sexy topic in the world to talk about loneliness. That being said, it is something that is incredibly prevalent and something that we're seeing in our own community, so it's important to really bring this issue to light. So the first story is a woman who was 94 years old who died of cancer in 2003. She actually decided that for her own preferences, she did not want to undergo any cancer treatment. She had no family. She described her friends as professionals, meaning the people that were around her were her doctors, her attorneys, her caregivers. And this was really her community. Now, what happened with her is that 1 week before she died, she told her friend that she felt incredibly lonely. So my question is this woman lonely? She said she felt alone. The second case is a gentleman who is 102 years old, and he died of what in the medical world they call failure to thrive, which is just there's nothing specific. He just wasn't doing well at home. He died in the hospital despite his preference to be at home, and the reason he died in the hospital is because he didn't have enough help at home. He was homebound, so we were seeing him in our program. He did have family, but they were out of state, and they weren't able to see him with that much frequency, even though they called weekly. He had a visiting doctor. He had amazing neighbors that looked out for him, and if they didn't see him around, they called us to let us know that they were worried about him. And he had other people that would check in on him, including in-home support services, which is a service provided through Medi-Cal to help people stay at home. So my question is he lonely? And the third case is an 82-year-old woman who is relatively healthy. Her only major medical problem is actually arthritis that makes her ability to walk around very limited. She has 4 children in the area and several grandchildren. She has live-in 24-hour help, and she has frequent social engagements. So is she lonely? So what actually is loneliness? So the way it's defined, and I think all of us may have an experience with it, whether we have experienced this personally or whether we've seen it with other people, but how we define it is actually the subjective feeling of being alone. It's also another way to describe it is that it is the distress that results from the discrepancies between ideal and perceived social relationships. So it's kind of a technical term, but this is how we define it for research in medicine. Now, the difference between loneliness and social isolation is that social isolation really refers to the complete or near complete lack of contact with society, or another way to look at it is the quantifiable, the number of relationships that someone may have, or the number of contacts that someone may have. So why does this actually matter? We know that, as Dr. Walter explained, we are all getting older. I think that's not anything that's not aware to all of us. And what's fascinating is if you look at the graph on the right, is that the number of older adults is increasing, not only here, but it's something that we're seeing across the world as well. And to give a little bit more of the numbers that were given already, we know that the number of older adults over 65 has increased almost 20% since the year 2000. And once you're at 65 years old, on average, you still have a potential life expectancy of almost 20 years, depending on your other illnesses you may have. We also know that the diversity among older adults is quite varied here in the U.S., where 21% of people over 65 are from different minority and other ethnic groups. An interesting statistic also for the women out here is that almost half of women over 75 are currently living alone. And we know, as Dr. Walter said, is that the biggest increase is actually in the population who is over 85 years old. So this is why this topic is important, is that loneliness is something that has the potential to affect a large number of our population of older adults. So about 28% of non-institutionalized older persons, so non-institutionalized meaning they're living in the community at home and not in any assisted living or in any nursing homes, live alone. As I stated in the last slide, almost half of all women over 75 are living alone. And then in terms of the prevalence of loneliness, in a study that we conducted, we saw that 43% of adults reported feeling lonely here in the United States. So that's a pretty large number. And when we look at studies in other countries, such as the United Kingdom, the studies there, depending on how you look at the data or look at the literature, is about 31% of people report sometimes feeling lonely, and then there's about 2% who feel lonely all of the time. So again, pretty significant numbers that we're seeing. And I think what's fascinating about this is that loneliness traditionally is not something that has been really studied and not something that's really looked at from a medical perspective. So why are older adults different than younger adults? Why should we even care about loneliness, or should we? I hope we do. I mean, we're here talking about it, and this is my area of research, so I hope someone cares about it. But the way I like to think about it, and this is a slide and some thoughts from one of our colleagues from another institution that gave us a talk a couple years ago, and the way we think about this is that for us in geriatrics and in medicine, the way we think about older adults is how someone is functioning in their life. And the things that affect someone's function include what's going on in their medical world, what's going on in their family and their social environment, are there issues going on with their financial world, what's in the environment, and what's going on cognitively and emotionally. So these are all the things that interact to affect function. So these are the circles in a younger person. What happens in an older adult is that these circles actually get much more intertwined, and they affect someone's function and ability to live independently much more significantly. So that as a physician, as a healthcare provider, as a member of a community, if I am not paying attention to all the different realms that are affecting someone's life, I'm missing a big piece of the puzzle and of someone's health and well-being. And so I need to be able to understand that. And for you, if you are someone who is seeing a physician, you need to be thinking about all these things as well and how they're affecting your health. So again, the question is the loneliness that we're seeing, could this be affecting the health of our community members? So an interesting statistic is that in San Francisco, we have the highest proportion of seniors and adults with disabilities of any urban area in the state. We also know that here in San Francisco alone, we have 20,000 people that are living alone. So thinking about the cases that we started about, my question to the audience and for us to discuss is, could any of these deaths have been prevented? Are we missing ways to prevent the loss of independence and potentially life if we're not asking about these questions? So should we be worried, and thinking about the three cases, should we be worried about them? We have one woman who was remarkably healthy and had a lot of support. Should I be worried about her? Should I not worry about her? What about the 102-year-old who had significant supports but was living alone? Should I be worried about him? So a couple myths about loneliness that I think are important to discuss, because there's a lot that's talked about there and a lot of assumptions that are made. And I'm pretty sure, unfortunately, I've even made some assumptions in my practice about who I think is lonely and not, which is why I've had to take a more proactive approach to talk about it. So one myth is that loneliness is actually not a normal part of aging, and that's an important thing to know. It is also important to realize that it is not the same thing as depression. While you may have depression and be loneliness, they are not the same, and you can be lonely and not depressed. Another myth is that it can't occur if you live with others or have friends, and another myth is that it does not exist if you're married. And another myth is that it will just go away very easily if you join a social group. So these are all things that are worth exploring. So thinking about the interaction as we discussed earlier with loneliness and social isolation is that they're different concepts. And social isolation, so the idea that we don't have enough social context, does not by itself account for the distress that someone may feel if they're feeling lonely. And that's an important thing to distinguish. So can we actually identify loneliness? So there is actually a really remarkable screening test that we use in medicine, or we have the potential to use in medicine, but it's something to think about for all of you, either personally or if you know other people or if you happen to work in the healthcare environment or in any community agencies. So there's actually 3 questions that are pretty simple, and the questions are, do you feel left out? Do you feel isolated? And do you lack companionship? And you try to think about these questions, whether you ever feel these often, if you feel these symptoms some of the time, or hardly ever. And that kind of helps to tell you where you are and if you're someone that's actually experiencing loneliness. And the reason why it's helpful to use these different questions is that sometimes someone may not actually identify with the word lonely, but if you ask them, I'm lacking companionship, that may be something that resonates a little bit more, so that's important to think about. So how does loneliness actually then affect our health? So I conducted a study in 2012 that actually looked at just over 1,600 participants over age 60. They were part of a larger national study called the Health and Retirement Study. It was a study over 6 years, and the participants were asked if they were lonely using the same questionnaire that I just showed. And people were identified as lonely if they responded some of the time or often to any of the questions. And what we were interested in the study and looking at is whether people who felt lonely had a higher risk of death and if they had a higher risk of decline in function. And we'll talk a little bit about what that declines in function. And to give you a little background, the reason I wanted to do this study is as a clinician and someone who sees older adults, what's very important to me is to understand how can I preserve someone's health and well-being, how can I have this person-centered approach, and how can I help someone maintain their independence? And my concern, being my background is as an anthropologist and someone who's very interested in everything else that isn't traditionally taught in medical school, is thinking, what are we missing and what should I be asking more in my clinical encounters, and also seeing that I do have patients that are reporting significant loneliness. So when we assess function, there are a couple things we look at. So we look at someone's activities of daily living. So is someone able to bathe, dress, toilet, transfer, and feed independently, or does someone need help? We also asked about upper extremity tasks, so the ability to raise things above your head. We also asked about declines in mobility, so that how far you're able to walk or the length of steps. And we also looked at difficulty in climbing stairs. So these are what we were looking at. Now, we also looked at a ton of variables, so this is a pretty busy slide. In general studies, what we do is we look at people's age, we look at their ethnicity, we look at their socioeconomic status, if they're married, other health measures. But a couple things that I want to show you. So in this study, we actually have a fair number of people who were reporting feeling lonely. 60% of people who were lonely were married. So again, that tells us that we can't make assumptions for someone that just because they're in a partnership, they're doing fantastic. And I won't ask all of you in the audience to tell me if you're married and lonely, but it is something that we see out there. I just got married, and so I'm hoping that I'm not in this group yet, but we'll see. And then the other thing is that of people who were lonely, only 26% were living alone. So again, it brings to this idea that just because you're living alone doesn't mean you're lonely, and vice versa. And I'll tell you in practice, I do have a patient who I took care of for years, and after he read my study, he came to me and he said, you know, Dr. Perissinotto, I know you think I'm lonely, but I just want to tell you that I'm not. I'm doing just fine. I live alone, but I love it, and this is what I'm doing to protect my health. I said, okay, great, thank you. So it's just important for us to remember and to not make assumptions. Some things that we saw, so we know that women were more likely to report feeling lonely. Non-white participants were also more likely to be more lonely. People who were lonely were slightly older, they were of lower socioeconomic status, and the majority were not depressed. And this is a really important point because when I first started doing this research, a lot of people blew me off and said, it's just depression that you're measuring, this isn't anything new, but it's actually a very different concept and something to be aware of. So what did we actually find? So again, a busy slide, but what I want to point out here is that look at the numbers. So this is the activities of daily living, so someone's function. And we saw a marked difference between those who felt lonely. 24.8% were losing their function versus 12.5% in those who were not lonely, so about a 60% difference. And similarly with death, there was a marked increased risk of death in people who reported feeling lonely. So when I conducted this research, I expected to see something. I didn't expect to see this magnitude, and so it was very, very surprising to me and made me realize this is something that we're not actually routinely looking at in medicine and in our practice, and we actually do need to think about this a little bit more seriously. So what my study concluded was that loneliness is actually incredibly common. It is an independent predictor of functional decline, so someone's risk of losing their independence. And what it means by independent meaning is that when you take out all the things that usually would affect someone's health, their medical problems, depression, their socioeconomic status, all of those actually went away, and loneliness by itself was still a risk factor. It's also an independent predictor of death. And the last thing is that we still have much to learn. So potential mechanism, there's a lot in the literature, and I don't know that I can tell you exactly what the actual cause is. We know that this is an association. There are a lot of theories out there, and I just want to touch on it, but there's nothing definitive. There's some thoughts that it's an increased stress response from feeling lonely that leads to some of these risks. There may be decrease in sleep, motor function, so your muscles working, decreased self-care in people who are lonely, but nothing's exactly precise, so we don't know completely. I do also want to say that my study has not been the only one to show the negative effects of loneliness on health, so I'm just going to show you a couple slides showing you what else has been written. So this was a study published at the same time as mine looking at cardiovascular health, and we did see that in this study, living alone was increased with an increased risk of cardiovascular deaths. This paper looked at older men, showing an increased risk of mortality in people who were lonely and not socially isolated. This one was related to loneliness and dementia onset, so another factor. And this is looking at both social isolation, loneliness, and all-cause mortality, so all types of mortality, not just cardiovascular deaths, but deaths by any cause were affected by loneliness and social isolation. And then the most recent study came out is showing that loneliness may be associated with frailty. Frailty is a syndrome and something we talk a lot about in geriatrics, which is when someone is actually losing their mobility and have decreased muscle mass, and that by itself is a risk factor for death. And what this study was showing is that loneliness was a risk factor for frailty. So the bottom line, and this is something that a paper recently published, is thinking about how you can conceptualize the risk of loneliness. And the idea is that if you are lonely, it could be the same as if you smoked every day 15 cigarettes. So it's a bigger risk than we actually anticipate. So how is this being talked about in the media? So when my study came out, there were some pretty funny articles that came out. This one was in the Times of India saying that loneliness can actually kill you. So that was a little bit dramatic, but nonetheless, I think it does highlight the seriousness of this issue. And then this is one that I thought was kind of funny or sad. It says, the study will make you feel terrible about not calling your grandparents. So, but at the same time, I think it brings awareness to the fact that we need to be aware of what's going on in our communities and in our older adults. Oprah has her campaign about saying hello to people as a way to combat loneliness. So lots of things out there that I think, to me, what signifies is that I'm just very glad that the conversation is starting and that this is an issue that's not being ignored. So what can we actually do? So the first thing is asking about loneliness, and whether that means asking ourselves if we're feeling lonely, thinking about our friends or other community members that may be lonely, and if we're asking other people or asking ourselves, that also means being prepared for the answer, because sometimes it can be very hard to have someone tell you, I feel lonely, because it can be distressing to you as the recipient of that information to say, what do I do now? Or vice versa, for yourself to realize that you're feeling lonely, that can be distressing as well. Sometimes I would say sometimes just listening is actually a remarkable healing activity. And this is a quote from one of my patients, an amazing jazz musician who was interviewed in the San Francisco Chronicle in 2012. And what she said is, if you want to avoid feeling irrelevancy, you need to maintain your friendships, maintain your family ties, stay an active part of your people's lives, in other people's lives in whatever way you can. And I think to that point, it's really remarkable that all of you have come out this morning for this activity. Internationally, what we see is actually in the United Kingdom, there's actually a huge campaign that's called the Campaign to End Loneliness, again, with the idea of bringing more social awareness. So the second thing you could do is think about talking to your healthcare provider if you are experiencing loneliness. Okay, so that's not to say that every provider is going to be super open to this idea, but nonetheless, I think it is something that is very important. You can tell them, listen, I've seen all the research and this affects my health, and maybe they'll listen a little bit more. And the third thing, which I do believe is one of the most important parts, is thinking about what helps you as an individual connect to others. So if we think about the circles in a little bit of a different way, so think about where are you fitting in with your connections? Where are your relationships? Are you in the middle? Do you have work and volunteer activity? Do you have friends, other interests, spirituality? What's going on in your cognitive and emotional life, and what's going on with your family? Or is this more what your circle looks like? Are you on the outside and not really at the center of it? Or maybe your circles are actually a little bit different. Maybe you don't have work or volunteer activities. Maybe you do have family and other interests, but you're still not at the center. The other option is maybe you actually don't have, or you have a smaller group of friends, but you have other interests, and that's what helps you keep connected. So there's not an exact prescriptive recipe for everyone. It's trying to figure out as an individual what matters to you and what helps you keep connected. And I think this is exemplified very well by Patrick Arbor, who's the director of Grief Relief Services and the director of the Friendship Line at the Institute on Aging. What he says, it's about reminding people that they're still a part of their community and that we work to encourage caring connections because that is what binds us to life. So other community programs, I'll highlight a little bit what's going on in the Bay Area. So this is a program called Linkages, which is out of the Palo Alto Medical Foundation, which has several different components. So one of them, what they call research matching, which is trying to figure out, okay, this is what you need. You need to find rides. You need to find meal preparation. How do we connect you with those services? There's also formation of micro-communities. There's also what they call time banking, which is really phenomenon, so really neat. So what it means is, say you're an amazing seamstress and you can sew buttons or fix pants, but you can't mow your lawn, and so you find someone else and you say, well, I will sew your buttons if you mow my lawn. And so it's a great way to make connections and utilize what other things have in your community. So that's pretty phenomenal. We're here, so this is an amazing research, and it's pretty remarkable to see all the program activities that are here. And I love going through the list and seeing what's out there because it really seems that there's something for everyone, which is pretty fantastic. And I should say that they're all also, it's not mentioned here, but for people who are homebound and not mobile, there is also something called Senior Center Without Walls, which is a pretty remarkable resource for patients who can call in and participate in activities when they can't leave the home. One other thing is the Institute on Aging up the street in the Friendship Line. So the Friendship Line has been around since the 1970s. It's an amazing resource. It's the only national 24-hour hotline for suicide prevention and support for older adults. They are unfortunately in the middle of almost losing their funding, which is very scary because it's been an amazing resource, and we're hoping to keep that going. But it's amazing what the Friendship Line and other services at the Institute on Aging does for older adults in our community, actually nationally. And then something that I just came up with recently, and I wish I knew more about it, was actually this website called San Francisco HealthyAging.org, and they are actually very focused. Our city's actually very committed to thinking about what's going on with older adults, and what they've been doing is actually providing computer access and tutoring to older adults in the city to help people keep connected. So other examples, so we have the resource fair right outside. I just did a quick walkthrough, but pretty neat to see all the things that are out there. So make sure as part of your day today you can see what else is available in the medical domain, but also in the non-medical domain. Elderwise, this is just a list of different programs. Elderwise, which is a program here in San Francisco also looking to connect older adults. Think about volunteering. Little Brothers Friends of the Elderly, who we saw was in the audience, which is a fantastic program that connects different generations of people, and many of whom are homebound, a fantastic group and someone who we work very closely with at UCSF. And then there's also the Village Movement. That's something that started in Boston and is kind of getting more grounds here in San Francisco, which is the idea of helping older adults age in place and how can we support that. lastly, the last part is just thinking about new platforms. And there's a lot of work being done, a lot of things out there to think about how we can all keep connected and how we can support people living independently. So this is something called Live Well Health, and the idea is that it's a web-based or computer-based platform. Again, similar to what Linkages is doing, but it's computer-based to help people keep connected. And then thinking about internet and social media, this works for some people, it doesn't for us. It's just a matter of what works for you. For some people, that is a remarkable way to keep connected. So my parents live in Santa Barbara, and I've emailed them for a long time, and that's been a good, in addition to calling and seeing them. But my mother has recently started texting, so that's a great way for us to stay in a little bit more daily contact. Sometimes her texts are a little bit too long, but you know, they work. So, but it's really neat, and it's really about finding what works for her. I'm not on Facebook, that's not my deal, but for a lot of people, that's what helps keep them connected. So it's not about telling you that's what you need to do, it's what works for you and how can we do that. And seeing that there are resources in San Francisco to help with computer training if that's what you need. So what are our tasks ahead? So funding for research on loneliness, I'm in the middle of applying to grants, which I hope I get, or if any of you would love to donate money, I'm here. I will take it. But there is a lot of work that needs to be done, and one of the things that I'm working on is thinking about, can we study some of these interventions? Can we see if the friendship line is actually working? We know that anecdotally it does because we hear the reports, but if we can actually prove it, then it's more likely to get additional support and have this be available for more people. So finding out which interventions work. The last part is spread the word, talk to people, tell people that this is an important topic that we cannot ignore. And the last part is thinking about looking out for ourselves and those around you, because there's a lot of things that are going on that we're not paying attention to. So going back to the three cases, so my 93-year-old patient with cancer, she was lonely, and she told us that at the end of her life, and there's a potential that she was socially isolated as well. Even though she had some professional contact, she really had isolated herself from the community. And my question is did that make her at higher risk for death? Is that what contributed to her not wanting to participate in cancer treatment? And she also felt incredibly more lonely when she moved to skilled nursing facility, which was interesting because she had been living alone. But that was a better place for her than being in the skilled nursing facility where no one knew her. And that varies from person to person. I've had some people that do much better in skilled nursing facilities, so it really varies, and we can't say one is better than the other. For my 102-year-old patient with failure to thrive, so he was actually not lonely at all, and he told me this all the time, but he was incredibly isolated. And then my 82-year-old woman who had a ton of family and resources, she was incredibly lonely, and that was her biggest complaint to me all the time, is that she was very lonely despite everything she had around her, and that was one of our biggest challenges. And I think what's hard as a medical professional is that sometimes we can throw all the resources out to someone and it's just not working. So it's trying to figure out what is going to make this person feel more connected. So in summary, we know that loneliness is common. I hope I've shown you that it does affect our health. It may actually be more distressing to ourselves and patients than traditional risk factors. So traditionally in medicine, we say you need to worry about your blood pressure, we need to worry about all these things. And what I'm saying is that not only is that important, but also loneliness and what's affecting our function and our ability to live independently. We also know that it's a risk factor for death. And I do strongly believe that we can make a difference by actually asking people about loneliness. And I'm hoping that we can actually explore ways to help older adults feel more connected. Thank you. So we have a couple minutes for questions. I'm going to ask you guys to come to the mic if possible. And remember that we're being videotaped, so one question per participant, and try not to make it a super personal story, but some is okay. So, front row.
Yes, on one of your slides, you kind of emphasized the word distress.
Yes.
And then in another slide, you mentioned increased stress response. So right. I'm wondering if you could elaborate on, is the critical matter as regards loneliness, if an individual subjectively fears being lonely more than the person who says, yeah, I'm alone, but I don't feel lonely, or the other person who says, yeah, I'm lonely, but it's not really impacting
I think that is a
adverse
fantastic point, and I think that's exactly what the theory is, but where we don't yet have the research to support it, but that's exactly it, is that somehow it's that, and that's why it's really important to figure out, is that feeling of loneliness actually distressing to an individual? And like I said, there are some people who don't have a lot of contacts, who are living alone, and they're okay, that's not bothersome. It's the people who that actually bothers them, and that's not an okay way to be. And the theories, but again, we don't have the exact science to prove it, is that so distressing that it's causing this increased stress, and that's what's leading to the declines, but we don't know that clearly in the literature. Great question. Yes.
What about the fact that as you get older and when you're really getting up there and you've lost all your friends and your contacts with the past?
So that is an incredibly good point, and something I see very frequently with some of my older adults that I take care of. And so I think that the reason why that's an important point is if we think about, let me see if I can go backwards, in some of the slides thinking about what are the different things that connect us. Let me see if I can get to this, this one. So it may be that as we get older, these circles are getting smaller and they're changing. And so what I like about this slide is thinking about, not that one, this one, is what else is there anything else that you still can feel connected to? So maybe you don't have your friends anymore, but are there people in the community? Is it coming to the JCC and meeting new connections? So it's not to say that that loss is not still present. It's a very real thing. And you know, I have patients who have lost their spouses years ago and who will never lose that feeling of loss and grief, but can they still move on to make a good connection? So very important part, very important point. Thank you for bringing that up.
My question is, my mother is 79. And she lost her husband, or my dad, 2 years ago. 10 years in a convalescent home, 15 years prior at home after a stroke, so 25 years. Anyway, I asked her that question, are you lonely, Mom? And she just blank, you know. And so just by observing her, she is definitely lonely. How do you engage? How do you motivate? How do you... You know, we all have choices when it comes to eating, when it comes to anything. She rarely gets up for her meals. She's isolated totally. What would you recommend a person like me, her son, trying to...
So I think, so tricky question, very important question. I think that this is a tough part in terms of how much can you as a son, a family member, versus when do you need to engage other support, because two important points, or maybe a couple points, but while I said that loneliness can exist without depression, there are times that there is coexisting depression, and so you do need to evaluate that part. And sometimes it's a matter of engaging in other ways in terms of if she doesn't want to respond to the question of loneliness, but you're suspecting that, it's trying to figure out, well, what are you missing? Is there anything else that you still enjoy with? There actually are several community agencies that we can actually go out and send someone to see the person if they find that connection. So it's just, sometimes it's a trial of an error of what else can we do to support that person. So, and trying to figure out what's going on at her nursing home, or have you talked to the nurses, have you talked to the staff to figure out? But it's a very challenging topic. And I think the other thing that's an area of gap in the literature is that we don't know that much about yet, but there's some speculations about, there are people that probably have lifelong loneliness and some that develop later on in life, and they're probably different groups. And how do we address those? I don't think we know the answers yet, but sometimes it's just, to answer your question a little bit more, it's asking the questions in different ways and trying to figure out, is there another way to evaluate her and find her what she may need.
So this is a question about causation and correlation.
Yeah.
And I think you were saying that people who were more lonely had a higher percentage of problems with their ADLs,
Correct.
if I understood correctly. But could it not be that people who can't do their ADLs become more isolated?
Very true. So that's a very important question. I think that's what's difficult about this type of study, that you're really looking at people over time, but we can't determine causation. So what we know is that there is a relationship, and you really can think about it both ways. We think that we really do think that it's loneliness leading to the functional decline and death, but it is possible that the relationship exists both ways. So very important point. Thank you.
I know you were trying to get through all the slides and then the information.
Yeah.
Could you describe again your definition for frailty?
Yeah, so, I struggle with the definition of frailty because it's actually, it's a very specific thing in medicine that they actually, the way it's measured, which is why it's not practical and a little bit challenging, is we actually look at someone's grip strength, and we look at, I remember, their a certain percentage weight loss in a certain amount of time, and what are the other measures, Louise, help me, thank you. Walking ability, and what else, I think that's, but the whole idea is that the underlying physiology behind it is that you're actually losing your amount of muscle mass. And your question is actually very good because in practice, we, as clinicians, we probably notice a lot of people as frail and we may put that term on them, but the way you technically are supposed to measure it is very hard in the doctor's office, and so we're constantly thinking about how can we actually meet these measurements and understand a little bit more about it. Yes?
Although your studies focused on the elderly,
Yeah.
I was just intrigued, wondering about in the younger populations, like men and women in their 20s and 30s,
Yeah.
with the common concern about not being married or finding the right one.
Right.
And essentially another way of fearing loneliness.
Mm-hmm.
Are the odds good that they would be at high risk later in their lives, whether they get married or not, to sense that pervasive, lifelong fear of loneliness?
Fantastic question, and I wish I had the answers. And I'll tell you, in the times that I've presented this study, a lot of questions come up about younger adults. And I do suspect that there are those people that are in their younger ages and will have that lifelong and at higher risk. But I don't think we know that. I don't think we know the answer. I'll tell you my 2 cents, maybe 3 cents. I do actually worry about the way we are engaging with social connectivity these days. I think that there is such a great amount of things that we can do with technology and connecting virtually, but I personally worry about that one-on-one connection. My sister was so mad when I got married in September that I wouldn't let her share my pictures on Facebook. And it was very amusing to me, but I told her, I said, Francesca, I would like to share them personally with people. If someone is interested, I would love to tell them about my wedding, not just have them look at my pictures online. And so that's my personal preference. And for me, it's very important to have that one-on-one connection. And frankly, I have found that, and I'm not trying to dissuade you, I'm not, whatever works for you, fine. But for me personally, I know that by not being on Facebook, people actually try to call me and talk to me. They call my sister and say, can you give me Carla's number? And then they call me. I'm like, this is so much better. I actually can talk to someone and have a real conversation rather than, hey, how's your life? Great, thanks, move on. So that's what works for me. But I also know that I am missing out on a lot of what's going on with my friends by not being on Facebook, but that's the choice that I've made. So, but I do think about how is this going to change how we age and how people are connecting. I mean, I wish I got real letters in the mail. I'll tell you that much. So.
I have a question. So as we participate in one of our loved ones aging, how do we find out what is perceived as a normal aging process, losing a little bit of their stability or their eyesight or their hearing, and what actually isn't normal? How do we find out about this?
Oh, that is... do we have like 3 hours to discuss that? So I don't have a great answer other than I think to echo what Dr. Walter said is that I do think that unfortunately the reality is that there are not enough geriatricians in our community. I do think that having someone see a geriatric specialist, sometimes even as just once, can help figure out where we are in that trajectory. There are many general internists and many other physicians that can pick this stuff up, but I think as geriatricians we have a more comprehensive approach to see what's normal and not. And I think the basic answer would say is that you have to ask the provider. You have to ask, are there some things that aren't reversible that are difficult to treat, like osteoarthritis? Yes. But I'll give you an example, to to assume that it is fine and not significant for someone to lose their ability to walk and watch them slowly decline, and to not make that a priority in medical visit is a problem, and that's something that needs to be addressed. And so what I would say, whether the loss of vision or eyesight is normal or not, what's most important is how that's affecting that person's ability to live independently. So for my patients, if they're losing their vision, it's not enough for me to just say, great, they're losing their vision. Whether it's normal for age or not, it's, are they at greater risk for falling now at home, and how can I keep them at home? So it's rephrasing the questions. Yeah.
Okay. Now, as we age, we tend to, let's see, do away with a lot of unnecessary sort of drama, friends, that kind of thing.
Mm-hmm.
And I was wondering if some of your research touched on the whole area of solitude, of preferring to have your time to pursue your interests,
Mm-hmm.
your thoughts, solitude as a positive thing.
Mm-hmm. So my research did not specifically look at that, but I think that that's, again, it gets to this question of subjectivity and how an emotion will make someone feel. And I do think that that's a fascinating thing, and I've seen it personally in my parents as they've gotten older. I mean, in my book, so I'm a geriatrician, and so how I consider someone being young is very different. So when I teach residents and I tell them I'm seeing someone young today and they're 70, they're like, what do you mean young? I'm like, that is so young. So my parents are 73 and they're now retired, and I have seen them really relish in that personal space of being able to focus on their interests. My dad's no longer department chair, and he's so thrilled about that and can restore cars and travel, and that's a beautiful space for him and reflect on his life. So you're right, there are some very positive things, which I would say the key point is thinking that we cannot make assumptions, that someone's individual experience is their individual experience, and it's trying to figure out, is that solitude a positive thing or negative thing for that person? Great question. You guys are tough, asking me good questions. I love it. Yeah. So question, how do we find geriatricians? So great. So here, we actually at our UCSF table, we do have our information about our practices. So that is here in the Bay Area. There are a couple geriatricians at CPMC, some people that were trained at UC, but our division is the largest in the city. So we have different capabilities, whether it's seeing someone for primary care or specialty care as a consult. The challenge is because of there's not a priority so far in our country to really make geriatrics sexy and appealing. So we have a big problem with recruiting people. So the more we talk about it, we're hoping to recruit more people into geriatrics, but it's a constant battle. But we do have a waiting list, unfortunately, in our house calls practice and in our geriatric center. Yeah. Great. Okay. Thank you.
Thank you very much. Thank you.